All right. Good afternoon, everyone. The Public Safety Standing Committee meeting of the Annapolis City Council is called to order on Monday, March 1st, 2021 at 4:03 p.m. Call to order. Roll call, Alderman Fred Payon.
Here.
Alderman Dewan Gay.
Not here yet.
And yours truly, Rhonda Pendell Charles is here. We'll move on to the approval of the agenda. Can I get a motion to approve the agenda?
So moved, Madam Chair.
Thank you. Thank you, sir. And all approve the agenda, say aye. Aye. Any opposed? No. Next, we'll move on to the approval of the minutes, PSC 02.01.21, approval of minutes. Oh, business and miscellaneous.
No, you were good with that, but before you move on for the approval of the agenda, you have to second it.
I thought I did, but okay. Then I second the approval of the agenda. Sorry about that. All right. Thank you. Thank you, Madam City Council Associate. There was a second. All in favor of approval of the agenda, say aye.
Aye.
A show of hands. Aye. All those disapprove, I see none. The approval of the agenda has been confirmed. Number one, business and miscellaneous, approval of the minutes, PSC 02.01.21, approval of minutes for the regular meeting. Can I get a motion to approve the minutes?
You sure can. I would so move.
And I second that. All in favor, say aye.
Aye.
Aye. Any opposed? None. Approval of the minutes has been done. Next on the agenda is supplemental appropriations, SA-24-21 Fire Department, Maryland Institute of Emergency Medical Services Systems, Revenue State Operating Grant Revenue, Maryland Institute for Emergency Medical Services Systems, $2,000, expenditure State Operating Grant Expense, Maryland Institute for Emergency Medical Services Systems, $2,000. Do we have anyone on from the City Fire Department? Oh, I see Deputy Fire Chief Spriggs. Good afternoon, Deputy Fire Chief Spriggs and Chief Romali.
Good afternoon.
All right.
How are you?
Good afternoon, gentlemen.
So this grant was already forwarded to Finance Committee. It's $2,000. It's a non-matching grant, so it's a 100% grant from the Maryland Institute of Emergency Medical Services Systems, and it's going to be utilized for some supplies for CPR training. I believe they intend on getting a child CPR mannequin and some other supplies that goes along for training aids. So it's a small grant, but we were happy to get it. MEMS had some additional funding there, and it'll be utilized for training.
Short and sweet, Madam.
Chief Romali, I'm sorry, what'd you say, Alderman Payon?
I said short and sweet, Madam Chair. I move approval.
Okay, discussion, I just want to indicate that the grant says we are receiving funding to assist our paramedic training of ALS, advanced life support personnel. We would like to purchase a basic child mannequin and a newborn advanced care simulator for more realistic training. Also, we're requesting pediatric advanced life support instructor package and 2 PALS books. I think this is an excellent opportunity. Anything that will help our children, I think is a wonderful opportunity. And I've heard a motion to approve this from Alderman Payon. Yes, ma'am.
Just wanted to remind you guys that this has already been adopted. I didn't know if you still wanted to take a vote on it, but the City Council has already adopted this essay.
Yes, I would still like to take a vote on it to be on the record that the Public Safety Committee did in fact approve this and is very excited about this. We've had a motion by Alderman Payon. I'm sorry, Alderman Payon. I'm sorry, say that again.
I said I might have to vote no, just, it's already been approved, so no, I'm only kidding.
Okay, good. Thank you. I got a motion from Alderman Payon. I second the motion. All in favor, say aye.
Aye.
Aye. Any opposed? I see none. The motion is granted, and therefore the supplemental appropriations will follow through. Thank you all so very much for this. We really do appreciate it. We'll move on to number 2, public safety spotlight. And did you know? And since we have our fire department here, do you all have anything to present to us today regarding a spotlight, or did you know?
So for our spotlight, we're going to defer to the Office of Emergency Management when they bring theirs up. They've had a project they've worked on this month that highlights several city employees in public safety for Black History Month, and that involves some firefighters that are in that. So we will defer to Chief Simmons on that one. And the did you know, I just wanted to make sure that the Public Safety Committee realized that we have had paramedics out assisting with COVID vaccinations for public safety. We teamed up with Anne Arundel County, and we're providing medics to assist with the vaccinations at their sites. We've continued that with some of the sites for the public school system, assisting the county fire department. As you know, the county fire department took that upon working with the health department. The fire department is actually conducting those vaccination clinics for the public school systems, and we've been providing assistance to them with some medics to do those vaccinations. We've also provided some EMS standby care for the state legislature while they did their vaccination program. So I just wanted to make sure that the Public Safety Committee knew that we were continuing that outreach, and we've been working with Chief Simmons I know he's going to push some more to get more stuff done in the city, and we will be assisting with that as it comes up.
Great. Thank you all. Thank you all so very, very much. We appreciate everybody's partnerships in working towards our vaccination program as well. I don't see the city police department on today, but I do, as your public safety chair, have 2 did you knows. Number 1.
They're on.
Number 1. Oh, they're on? Okay. City police department, do you have a spotlight, or did you know this afternoon? Chief Jackson and Deputy Chief Branford. Good to see your names this afternoon.
Yeah, we've been trying to get on. There we go. I don't know what was happening, but we were trying to get on. Good afternoon, Madam Chair. How you doing? Good afternoon, Alderman Payon.
Good afternoon, Chief.
I was listening in on some of what you had to say. We were trying to get on. We had trouble getting on. I'm sorry, you were asking me a question?
Said, do you all have any spotlight? Any persons you want to spotlight this month, or any did you know information that you wanted to provide to us today?
Spotlight, we've had so many good things going on. We're going to have the first graduation very soon. I don't have the exact date, but I'll get that to you for the reentry. The first cohort of men and women are about to graduate. They've completed their training. For the first time, we have Officer of the Month. I made everybody Officer of the Month. We had 4 officers to do some wonderful things. And what it was hard to choose, so we just made all of them Officer of the Month. The seizure of 4 handguns recently. I don't know if you know this, but near Tyler Avenue in Robinwood, a couple of weeks ago, we received a call from a citizen who wanted to report 4 armed subjects in the area of Tyler Avenue. I think it's Marks Court, if I'm pronouncing it right, but it was right off of Tyler Avenue in Robinwood. They had 4 weapons, fully loaded, locked, and ready to go. And my officers were in the area. We had a very rapid response. We were able to seize all the handguns and charge all those involved. And still an active investigation. I'm convinced that there was getting ready to be a shooting that we disrupted and thereby prevented any serious injury or death. So I'm very proud of the officers. And help me out, Stan, because I'm doing this extemporaneously. The second one was an officer did some community service stuff.
Yeah, but here's the key to all of it. We had 4 Officer of the Month requests come up. And when we looked at them, we said all of them did good work. All of them wasn't such that the guys went out and, ran down people and got guns. And the message that we put out there, we don't want to create a competition with the guys. We just want them to do good work. So the guys that got 4 guns, we also have someone who got that done some work in the community that helped out some citizens. So we looking to make sure we recognize all officers for the good work they do, not just those who get those type of arrests. They're still necessary, but we want to recognize everyone, and we take the competition out of it. Hopefully with that, it'll cut down on some of the complaints because the guys not competing with each other, trying to get the Officer of the Month award.
Fine. Now, my question to you all, do you all have a special parking space for the Officer of the Month on your lot?
Yeah, they're gonna have to fight for that spot.
That was my next question. You gonna do it by the week, or how you gonna do it?
We'll do the game like they used to do when you're in elementary school. Everybody walk around a chair, and so we'll have them all drive around. Whoever's closest to the parking space, once we clap our hands, if they're in the parking space. Does that sound like a plan, Stan?
Okay.
Sound like a plan. But in addition,
the accidents, I want to go on the record for the city attorney. I'm not responsible for any accidents, but we'll just ride around, whoever closest can just cut in. But I have to disclose I'm not responsible for any accidents.
But in addition, they all get a gift card also.
That guy just heard you.
Well, good. That'll make up for the parking space. Okay, sounds good.
But we have so many things going on. But did I miss anything else?
No, so we do have, I think, the first cohort of the reentry graduating.
Yeah, I talked about that. Yeah.
So, and we put together a team that's going to be looking at job placement. So one of the things that we talked about, it's good that these guys get this training, but beyond the training, what do we have for them? So we got something together where we're talking to employers in the area, and we're going to advocate for them to get employment. They're teaching them resume skills and interview skills. So Rob Horn, Michael, Sergeant Redondo, they're good at doing that stuff.
Oh, and one other thing real quickly. I'm going through the leadership and Arundel along those lines. I'm actually a participant, but on March the 11th is Public Safety Day, and I'll be one of the presenters to the leadership and Arundel. And we have different assignments. They divided us up in groups, and we're doing the promotion plan for the reentry program. With Vanessa Bright from Anne Arundel County, and so we're going to do a marketing plan. She has a power washing business, and it's not for profit, but she hires young men and women from Annapolis, the city of Annapolis, and Anne Arundel County who are re-entering, and the business apparently is doing very well. They do it for under market value. And so the leadership of Anne Arundel County, as a part of our group project, are doing a marketing plan for the power washing business and promote it out as a reentry, or we call it positive impact in the city of Annapolis, as you well know, Madam Chair. You partially named it, the positive impact instead of reentry. We're doing it for both jurisdictions, so I'm excited about that. I think that's pretty much it for right now.
Okay. All right. Sounds good. Office of Emergency Management. Any spotlight, or did you know? And I know also everybody somewhat combines for written reports and comments and year-to-date overdose summary.
Hey everybody, how you doing?
Good to see you this afternoon. Good to see you.
Good to see everybody too. Let me get myself together. Okay, I have a PowerPoint, Julian.
So I had found it too. Thank you, Peggy.
So I just want to congratulate the chief for getting those guns off the street. That's a very, very important piece of business. And I heard about that. Good job. So
thank you, Chief. I appreciate it.
Absolutely.
Our spotlight is the OEM has recognized many African-American leaders during Black History Month. We put it on social media and also our spotlight is past African-American pioneers who had an impact on public safety. So I want to recognize 3 of them. So I'll start with Chief Joe Johnson, who was the first African-American police chief in the city's history, serving from 19 94 to 2008. In February 2020, the city renamed the Annapolis Police Station to the Chief Joseph S. Johnson Police Building in his honor. Even though that Chief Johnson retired over 12 years ago, he remains a beloved icon in the Annapolis community. When I came to Annapolis about 10 years ago, I was fortunate to be able to learn from him how things work in Annapolis. He was a good mentor to me. And police chief and fire chief, feel free to join in on this because I know you guys are associated with these folks as well. So Captain Cynthia Howard was the first African-American woman to hold the ranks of sergeant, lieutenant, captain at the Annapolis Police Department. Captain Howard provided 30 years of dedicated service to the citizens of Annapolis. And what I remember about Captain Howard is that she was very approachable. She was always willing to assist you. And if she could not solve your issue, she would find someone who could. And like Chief Johnson, she was a pillar in the Annapolis community. And last but certainly not least is firefighter first class Claude Shorty Coates. He was the first African-American firefighter hired in the city of Annapolis. Firefighter first class Coates provided 25 years of service to the citizens and visitors of Annapolis. I had the pleasure of meeting Shorty Coates on one occasion where I was able to thank him for his service and making the path in the fire service a little easier for people of color, people who look like me. So on that note, if it's any other comments from fire, police about these fine representatives of Black History Month.
A lot of people don't know, but I was one of Chief Johnson's sergeants in Baltimore. He was actually my commander. So I do have an attachment to Chief Joseph Johnson. And when they dedicated the building after him, that was one of the first things that I said, what an honor it was, because he was actually my boss in Baltimore. So what an honor. All three are just, it's wonderful. It's a good job, Chief Simmons.
Absolutely.
It's actually a good job. It's a good job from all three of them.
Mm-hmm. Absolutely.
Thank you for bringing that to our attention. It's so important to take a look at history. Alderman Payon.
Thank you. If I told you that I had worked with all three of them, does that make me older than dirt?
Yes, sir.
That's what I thought.
No, just older than sand, not dirt.
Well, Alderman, I'm there with you because I work with all three of them also. So, yeah.
Yeah. That makes three of them.
Folks, Shorty Coates is the one I knew the least. And also, I'm going to defer to Chief O'Malley to just tell us a little bit more about Shorty.
Yeah, Shorty grew up around the city of Annapolis. He was well known when he got the job here. He was actually working at the local hardware or lumber yard when one of our former chiefs, Jerome Smith, actually advised him or told him he should put in for the job, and he did very well while he was here. We recently, well, not recently, it was during COVID, we planned on doing something larger for it, but we couldn't. But we dedicated the engine 381, which is the new fire engine at the Taylor Avenue station, to Shorty. So there's a plaque on the side of the engine. We were able to meet with him and his family because it had to be a smaller event because of the COVID restrictions. They actually had a family event in his house. We had several members of our department went down there, and we were able to dedicate that engine to them. And he was very humbled by that. But Shorty still lives in the community. He's well known in the community, and he paved the way for a lot of people within our department. And he's very proud of that, and we're very proud of him.
Thank you so very much, Chief O'Malley, for that testimonial. Shows how things come full circle. I'm also with Anne Arundel County Public Schools full time, and for 7.5 years, I was assigned to Frank Herbert Harmon Elementary School. So between 2018 and 2019, Captain Howard, as she is with the County Police Department, was one of the persons who volunteered through the county victim services through the county outreach services to come to my school and volunteer. And she brought 3 others with her. And so I used to see her on a weekly basis for that year period of time. So you never know who you're going to run into, who you're going to work with again on another level. But she worked with our second graders, Miss Baglioni's class, and they loved her. They couldn't wait to see her come every week on Tuesdays. And it was a blessing to see her and have an opportunity to chat with her. And they did some other things in our elementary school. We have 800 students there and 90 staff. So she was very instrumental along with her team in bringing youth programs, youth outreach, and just talking with our students at our school. So kudos to Chief Simmons for bringing this to us. History is extraordinarily important. Chief Johnson, Captain Howard, as well as firefighter, Mr. Shorty Coates. So this was certainly a surprise and a pleasant one. But thank you, Chief Simmons. You're always pulling some rabbit and something out of the hat that that reminds us of who we are.
Thank you. So do I proceed?
Yes, sir.
So my Did You Know segment is to highlight the great work and relationships and the partnerships that public safety has. So I'm glad that I still have the fire chief and the police chief on. So there's no better approach to solving all our challenges than the famous saying, 2 heads are better than one. In today's pandemic environment, a do-it-alone approach is not the best strategy to address our many challenges with the pandemic. So collaborations between our departments and our partners are the most effective way to solve these complex challenges. So if you want to travel fast, go alone. If you want to travel far, go together. And that's a testament of us working together. So next slide, please. So I want to talk about the Stanton Center warming program. Our motto is nobody dies on the streets of Annapolis. Nobody dies from exposure on the streets of Annapolis. The Warming Center has been sheltering many Annapolis street homeless for the past 10 years. The economic impacts of the pandemic has caused an increase in the homelessness. This year, the Lighthouse Shelter has joined the Annapolis team to support a more robust warming center program by donating additional funding for warming center operation. And this additional funding pretty much allows it to be open every day. In the past, we only opened when it got to be 25 degrees. Now at 32 with this extra funding, we can open up at 32 degrees and get people off the street. So who are the partners here? Next slide. So these are all the partners that make it happen. Office of Emergency Management, Blessed Tech, who manages the overnight. Lighthouse Shelter, who gives us funding support. The fire department that makes sure that the building is right. The police department that provides security. And they also bring folks from off the street that need to be sheltered in the Stanton Center and Reckin Parks. So good partnership there. Next slide. So do you know public safety partnerships, Annapolis food insecurity programs? Food insecurity across the country has risen significantly since the pandemic, has sidelined 14 million workers in the United States. Many Annapolitans suffer from a food deficit. So there are 2 Annapolis food programs that have served our residents since the beginning of the pandemic. And that's the Tuesday Food Drive and the Food Friday program. These 2 programs will help fill the void, the food void many families have experienced since the beginning of the pandemic. And the combined cooperation of the many partners that make this program possible. So the Tuesday is held at Pitt Moyer. I want to say 2,000 to 5,000 pounds of food every 2. A tractor trailer brings it in.
Whoa.
Families are impacted by the pandemic, are lining up around the corner, and food is available for pickup from 12 noon to 2 p.m. Food Friday program is every Friday at Pitt Moyer. Started out at OEM, just grew too big. Target is our elderly and most vulnerable citizens, and we do home deliveries with that. Yes.
Chief, are these already broken down into allotments, or are they come and take, hey, I'm going to take a pound of meat, I'm going to take this head of lettuce? I mean, do you guys actually do all that first and then they just pick up the bags? How does it work?
So we do not know what we're going to get. Again, they pick it up at noon, but we're 8 o'clock. We're at Pit Moyer waiting for the truck and sorting. Some stuff comes sorted, a lot of stuff does not. So we put it all together and have it ready to go by noon. Now, the Food Friday program, that's all assortment. Everybody's sorting there. And that's been the longest program that we've had, even since before the pandemic.
How many days worth of food is this? I mean, what's the estimate here?
I would say that they each get about, depending on the family, at a minimum about a week.
Wow. Okay, great work.
But it could be more for smaller families.
Thank you, Chief.
Next slide, please. So these are the partners in the Tuesday food program: Emergency Management, Light of the World Ministries, Pastor Cheryl Menendez, Maryland Food Bank, Annapolis Police Department, Annapolis Fire Department, and Department of Rec and Parks. And in the Food Friday program is Office of Emergency Management, the Anne Arundel County. Julian, help me.
And we're trying to let Alderman Gay in as well.
Okay.
Okay.
Madam Chair. Madam Chair.
Yes, sir. Yes, Alderman Gay.
Yeah, thanks. I just wanted to point out one thing on this slide. We should also
can you let Director Simmons finish this slide and then ask the question once he finishes the slide? Is that okay?
Yeah, no problem at all. Definitely.
Okay, all right. Finish that slide, Director Simmons, and then Alderman Gay has a question and a comment.
For Food Friday program, Emergency Management, Anne Arundel County Food Bank, the Mayor's Office, Blessed Tech, which is a nonprofit, and Department of Rec and Parks.
Okay. All right. Alderman Gay, your question and comment?
It's just a quick comment. And I'm just because there apparently has been a clear delineation made in the recent weeks between the mayor's office and the city council. So also on that should be, on the Food Friday program, should be maybe a note that says city council, because we did just vote for $115,000 to go towards the Food Friday project. And that was brought before the Housing and Human Welfare Committee as well as Finance. I just wanted to throw that in there because I want people to know we support it too.
And what did you say, 115 what thousand dollars?
115,000. Yeah, it came from the CBDG funding.
You know, I'll put it in big block letters for that amount of funding. I appreciate that.
All right. Thank you, Alderman Gay.
Next slide, please. So again, partnerships, COVID-19 testing. OEM entered into a partnership with Anne Arundel County Health Department to provide COVID-19 testing in the city of Annapolis. This partnership provided the first pop-up testing in Anne Arundel County. Do you remember that, Alderwoman?
Yes, I do. At the Parole Health Center.
It was.
At the Parole Health Center. Yes, it was.
The first one in the county.
Yes,
program started
I think it was the second week in April.
Yep, started in April 2020.
Second Monday in April. Second or third Monday in April. Yes, it was. Thank you.
So we had pop-up testing sites throughout the communities in the city to provide equal opportunity to free testing. Since the start of the program, we tested 5,195 tests were administered. There's less of a demand for testing, and everybody's priority now is getting the vaccine. So the Office of Emergency Management is transitioning from testing to securing vaccines for our most vulnerable and low-income senior populations right now, and we hope to expand that. So, so the partners here are Health Department, OEM, and Rec and Parks. Next. Public safety partnerships, COVID-19 vaccinations of vulnerable and underrepresented seniors. Our seniors are most vulnerable to the COVID virus. This especially pertains to seniors of color. Many seniors lack the ability to navigate the online registration process. They don't possess computers, or they don't have transportation to get to one of the county's vaccine clinics, as there are no clinics in the city of Annapolis. The Office of Emergency Management and Luminous Healthcare, the hospital, has partnered to take the clinic directly to the seniors. So far, the clinics have performed clinics at Morris Blum, Bloomsbury Square, and Bowman Place. As more vaccines become available, the program will be expanded. So we're working to get more clinics in the city of Annapolis, which we need to do.
Absolutely. Thank you for that, Chief Simmons. I think in the Capitol, the past couple of days, there was a front page photo of someone from one of our senior centers in Annapolis who was photographed getting the vaccination.
That was Morris Blum.
Morris Blum. Okay, I couldn't remember which one.
We vaccinated 100 people that day at Morris Blum.
All right.
So, all right, moving right along. Next slide. Year-to-date overdose overview. Next slide, please. So here are the numbers. These are the new numbers, 2021. Total overdoses is 19. Fatal overdoses, we think, will be that where it says pending 4. That's pending a disposition from the medical examiner's office. We think that's going to be 4 overdoses. So if you go down to the bar graph by ward, we've had 2 overdoses in Ward 1, 1 overdose in Ward 2, 3 in Ward 3. In Ward 4, we've had 5 overdoses. Ward 5, 1, Ward 6, 4, Ward 7, 1, and Ward 8, 2. Can you go to the next slide, please? So here's some of the demographics with that. Of the 19 overdoses, 8 were Black, 11 were white, 16 were male, 3 were female, 1 in the 18 to 24 category. In the 25 to 34 range, it was 5. In the 35 to 44 range, it was 7. In the 45 plus, it was 5, and we didn't have information on 1. And as far as the drug type, the most prevalent type is heroin and opioids. And then the other categories is 7 unknown. We didn't have enough information, and 1 other. I do not know what that other is. And we haven't seen any bad reactions from PCP this time around. Next slide, please.
Oh, Alderman Gay has a question.
Sure.
Yeah, thank you very much. My question is in regards to the demographic breakdowns by ward, because when I look at that and looking at the wards that were pointed out, obviously primarily African-American wards, but the most prevalent race in regards to overdoses are Caucasian. So when they collect the data, say if I arrive in Eastport Terrace, right, and there's somebody who is having an overdose or they're having a reaction to the drug, am I saying they are in Ward 6, this is an overdose in Ward 6, or am I looking at the person's identification and actually saying they live in Severna Park, but they're coming to Annapolis to buy their drug, and so I should be tracking this as unknown? Because right now you have unknown as 0, or are all of those people city residents?
So the OD is identified where the OD took place. So if it was if the person lived in Severna Park, but they were in a house in Ward 4, it's going to show Ward 4. Now we do have information, and I can possibly bring this at the next public safety meeting in April, where they actually live at. We have that information.
Yeah, that would be so helpful, because I think to me was what it appears, and just based off of general knowledge, I'm young, I'll be in the streets. But, you're just hearing, and it's like, this person wasn't living here, or just some backstory or situation obviously always taking place. And I just think that that's important, because it reflects on, us, where we spend dollars or whatever as we get into the budget season. If we're thinking that we're having this legitimate crisis, which we still do in the city of Annapolis, but if the numbers could reflect, differently, as opposed to all 19 of these overdoses happen to city residents, as opposed to maybe, 17 were city residents and the remainder were out of county or whatever, vice versa. I think that'd be helpful.
Yeah, we have that information. I can bring that information to the April public safety meeting.
Okay, thank you so much.
But it's where they were found is how we actually capture the data. Okay, and in this last slide, let's do a comparison from 2020 to 2021. This time in 2020, we had 20 overdose, 3 fatals, and now we have 19 overdoses with what's going to be pretty much 4 fatals. So we're ahead on fatals, and remember, we were up 123% on fatal overdoses in last year. So if we can't get in front of this, if we can't stop this, we're on course to be about 120 overdoses, and then we're going to get the amount of fatals that we almost had last year, which should be about 24-ish, if we can't get in front of this thing. Now, we had a meeting last Friday with fire, police, OEM, and the mayor's office. We funded everybody's program. Everybody has significant funding to get us at least the next budget year. Hopefully that everybody's going to be very, very proactive, aggressive, and have a robust program in effect to kind of thwart these numbers until we get to July 1. And then July 1, we have to come up with some other funding to keep funding this to the end of the year.
Alderman Gay.
Thank you, Madam Chair. And I'm sorry, I can't help but to ask questions with this topic. So if everybody's fully funded just until July, and we're just trying to get an idea of what we could potentially change in the next fiscal break, what maybe would be some recommendations, or maybe even in the next meeting, if the professionals, meaning OEM, police, fire, could recommend to us what we could do? Because we had obviously no harm, which went great. That is not a thing anymore, because now it's focused on VIP, which is a complete violence interruption, which is a completely different program. And so what concerns me is that as elected officials, I'm speaking solely about myself. I'm not speaking on any of my colleagues, because I don't know what their mindset if it is going into it. But for me, it is like, I'm looking at other jurisdictions, what they've done to be successful. And so sometimes that is the radical approach. I know I talk about often with Delegate Penna Melnick, who represents a portion of Anne Arundel County, introduced in the General Assembly, which we pitched to the city council. I'm not sure where it made it after that. I think it went to the city manager's office. But some of the more radical approaches, like actually providing the resources in the communities and all of that stuff, but that didn't get funded. So what would then be the next step if Safe Stations is operating effectively, or as effectively as it can be, with people walking into the fire departments and asking for assistance, and OEM being as effective as they can be with some on the boots programs, then it leads me to believe that our only option left would be to try some more radical and open approaches. But I want to get the opinion of the professionals. Like, what are you guys' thoughts in this? you know, seeing that we ran into COVID and all of this other stuff? Like, where else can we go?
We have some out of the box programs that we don't talk about, and I'm not going to talk about. Oh, what was that? And I'm not going to talk about at this meeting, but we certainly offline can talk about some of the things that we have going on that's maybe considered a little radical and out of the box thinking. But we have a solid set of programs. The fire department has Your Life Matters. We have a solid set, OD free, and Office of Emergency Management. We have the police program, which has a clinician now that they actually go out at every overdose and interact with the person and their family to see what kind of resources that they need. And then
is that clinician hired? So that's in the fire department, you said?
It's in the police department.
In the police department, okay. And so are they hired independently? Is that their only job, or are they a detective and part-time I am tending to opioid overdoses?
So this person is on staff part-time, and that's all we can afford right now.
Okay.
But they do work with like Sergeant Vaden, who has the crisis training. And this is a neat program, and we tried to get it underway at the beginning of the pandemic, and it just didn't work out. We had the funds, we had the people in place, pandemic hit, you know, it circled the drain. So now it's up and running again with a new wind at its sails. And I'm really thinking that this is going to make a difference. This program is going to make a difference. And the people that are in the program are very, very dedicated. Another thing that we're doing too is that we're seeing a lot more safe station activity. We're trying to figure out how to follow them from safe stations to treatment. And when they come out, help them with quality of life issues. You know, how can they get a job? How can they get training? How can they get a life coach mentor? You know, how can they expunge minor records? You know, how can they learn financial literacy to give them a good start to be productive citizens?
So and I'm sorry, I'm just talking through this again, just getting caught up on some of the things. And so would that program, and again, this is completely ignorant, I'm not sure of the operations within the police department, but would that program be better served under, for example, OEM or the fire department, considering that they're engaging daily with those, especially at the safe station, if you're trying to do follow-up? Let me just give you a quick example of what I went through personally. And this is in this last summer. I had a resident come to me. I met her at the Eastport Community Center. She said that, you know, she was having some issues with drug abuse. So we met there. I called the county. They sent out a representative to the Eastport Community Center to meet us there. That was about an hour in between. Now, in that hour in between, I bought her 2-pack of cigarettes that she burnt through because she was so nervous about going through this program, and she was not sure if she wanted to commit time to leaving her family to go through that. They came and picked her up. She was gone for about 2 or 3 weeks, and we kept in contact via the phone. She had issues with clothing, transportation, work, and a number of things. And so it made it difficult for her to get to the assistance that she needed, to the point that you're making, because she didn't have the follow-up. Not because, I don't want to say the program wasn't effective, she just didn't have the individual case management that I think that we have discussed within the city of Annapolis, in particular with the Office of Community Caring Services and Rhonda's initiative as well with the mobile resource van. And so how do we fix that? And so that we are giving the care at our fire departments or whoever, but we're also following up with the appropriate staff. Is it because it is a part-time thing and they aren't able to dedicate the necessary follow-up, or is it just because, you know, there isn't a legitimate procedure in place to follow up with these constituents?
Well, there is a legitimate follow-up, and the police, and that's the premise behind the police program, is that they follow up on every overdose. You can actually call Sergeant Vaden in your particular case. I mean, you started with the county, and that's great. but you do have resources here in the city. And you could call Sergeant Baden. Sergeant Baden could take it from there. And Sergeant Baden is here. Sergeant Baden is here in the city. And that clinician, and I forget the person's name, is here in the city. But to get back to the different areas, fire department, OEM, police department, mayor's office, they all see this thing from their lens and what they're exposed to. And that's the great thing about these programs is that when you do Your Life Matters, it comes from their lens. They designed that program to have make it effective here in the city of Annapolis, and I think that's something unique to us, and we just need to be consistent in funding all of these programs. We brought in the social worker, we brought in Officer Horn and Officer Smikle to be a part of this opioid intervention team. So as we grow, the programs are growing and they're becoming more effective.
And just I'm sorry, Madam Chair, I just have a follow-up. Because, and again, I'm acknowledging that excellent work has been done. But to the point that you made, Director Simmons, I think that's what my concern is that there are so many programs spread across each individual office. You have fire doing their thing, OEM doing their thing, the mayor's office doing their thing. And I think that we sometimes overlap and miss points that are critical. And for me, it would be much better if we were saying, this is our one front on opioid intervention. This is what the city of Annapolis is going to do. You know, taking into consideration the research that fire, police, and OEM has done and putting together a unique plan that fits the needs of our city. Because I think we can give 150 to OEM, 150 to fire, 150 to police and say, tackle the opioid issue, and we still wouldn't be meeting the needs. And so if there was a way that we could all get on the same page with council consideration about how we effectively fight this, that would make me feel a lot better, because otherwise I just feel like that we might just be putting the money to it, but not actually meeting the legitimate needs. And I think that's what my concern is as we continue to just see trends over the last 3 years continuing to go up, so that's just my thing.
So I might not be making myself clear, Alderman. We are one unit. It's not fire doing their thing over here and police doing their thing over there and OEM in the middle and the mayor's office doing their thing. We all together, we plan together. We have meetings together, the Annapolis Opioid Intervention Team. We just met last Friday. So it's not like we're out there doing our own things. We are together as one unit to tackle this problem.
Director Simmons, I think we need to we got an email about a month or so ago about the 150% group. And that to me was definitely a wonderful opportunity to put all of our resources together. On that is Robert Horn, Bishop Carroll, Danette Smikle, Castor Redondo, Aaron Lee, Adatola Ajayi, Katie Edwards, Erica Griswold, Asia Wallace, Laura Gutierrez, Nicole Queen, and Mary Kate Seborowski. From my understanding, it's going to grow. They meet regularly to talk about, and I won't call it triage system, but it sounds like to me that it's becoming a triage system where we look at different families, persons, communities, where all of those community services type opportunities come together. And when I got that email about a month or so ago, I thought, this is great. This is wonderful. This is the perfect opportunity for everybody to talk, be on the same page, find out what's going on. Because even with the Partnership for Children, Youth, and Families in the county, they have the cricket team. They have basically regular cricket. They have a senior cricket, a baby cricket, and it's basically a triage system where they all talk about certain family or families and what those basic human needs and social services are as well. So I think this 150% group that started about a month or so ago, I think that's the perfect opportunity. And I think that's a good did you know for today for our public safety team. If you wanted to add, or anyone who wanted to add something to that, Director Simmons, Chief Jackson, or excuse me, or Chief Romali, that would be great.
And can I follow up at the end before you move on to questions, Madam Chair?
Say that again, Alderman Gay. No, I wanted them to respond to the 150% group.
Yeah, and my question was at the end of that, could I have just a quick second before you move on to our other colleagues?
Oh, sir.
Okay, awesome.
Oh, certainly.
Yeah, and I think that Alderman Gay, I think it should be noted from the police end, we're a 24/7 operation. We never shut down. So when we have overdoses and for anything in crisis, for that, for anything in crisis in that regard, whether it be emotional, mental, overdose, the system that we're trying to set up, because it starts generally with us, the police, and the reason why we're so involved because we're out there. Robert Horn, Michael, they don't stop at the end of the day. A lot of these social agencies and service providers have an end time. We're 24/7, holidays, weekends, we never stop. So when we encounter a person, ODs don't stop at 5 o'clock. We get people on the street who have overdosed 3 o'clock in the morning. So we're able to get the ball rolling to get them that aftercare that you mentioned. And so I don't see how it can work unless we have an agency, which is the police department and the fire department, that never, ever, ever shuts down. So when we encounter these people, we want the community to know that we're not only out there to provide law and order, but we're out there to provide public safety. And the part of public safety and the part of the public safety team, to Kevin's point, is that when they encounter a person in crisis, whether it be an overdose or some other crisis, we're right there to provide intervention services and get the ball rolling. And it has nothing to do with arrest. So I just wanted to throw that in. If you don't have anything else, Director Simmons, to add to that.
No, I just had a comment. I just have a comment, and I know that Alderman Sandelmeyer has had his hand up for a while, but I just had a comment on the 150 group, is that I'm hoping that I'm invited to an upcoming meeting. I've heard about them, I've heard good things, but I have not been invited to a meeting, so I'm hoping I can get to see and experience this group and find out what it's all about.
Chief Romali, did you want to add to that?
I don't have a lot to add to it. We obviously, like Chief Jackson said, we're here 24 hours. We're the response agency. We're the agency that comes out when the person is overdosing. We're the life-saving procedures there to try to keep them breathing and keep them moving along. Our Your Life Matters program is just that. It's to train the people in the public to be able to do CPR, to give the Narcan program. But every overdose we go to, the police is notified, and that starts the ball rolling for the OD map that goes along with it and the follow-up from there. And the safe stations is it. We're just the filter for the safe stations. They come here, they know they can come here with no repercussions, whether they have drugs or whether they're actually wanted. They're coming here because they want help. We point them in the right direction. We get mobile crisis involved, and we go from there. But I would agree. It's an overall. It takes everybody. It's not just one agency here. And I would say that all the agencies are working together. Nobody's out just doing their own thing. But obviously, we offer any help we can give to it from our aspect, and we're here to do anything that the city wants to move forward with.
And we go to those 150. We go to those 150% clubs, and I'll be quick. To make sure exactly that there's not a duplication of efforts. I've been to 2 of them now, and what we talk about, we take actual cases, Alderman Gay, and we look at them, and we make sure that there's no duplication of efforts. We carry the ball as far as we can carry it. We stabilize it like Chief Romali does in the fire department. We save lives, we stabilize the crisis, and then we pass it on. Often that takes us into the next day when the social workers are available and other service providers are available. And then we kind of case conference it to talk about, how we can support each other, with Chief Simmons, how we can support each other to make this thing flow smoothly. So that's that's basically how it operates.
So and just in closing, because I realize my other colleagues have questions, and this is again just completely for you guys maybe to chalk it up and think about. But what I'm continuing to hear, what I think would be helpful is if the public, instead of picking up the phone and calling the police department or whatever, in their follow-up, if they had a specific staff member to follow up with, because you mentioned the 150 Club and you mentioned some really, really good names, I mean, in staff members, but those staff members aren't solely focused on opioid intervention. They're running the Office of Emergency Management. They're running rehabilitation programs in the communities, trying to get people connected to jobs, just so much. And I think that is part of the problem with our public safety staff. I was just having this conversation with a colleague of mine earlier in reference to some of the budgeting needs that we were, negotiating. And we're like, look, you think that this person is just walking the dog and carrying the bomb sniffing dog all day, but they're actually, to the point that you guys have made previously, they're doing like 18 other things. And that's what worries me, because if this person their job is to, okay, I'm solving cold cases, I am working with the rehabilitation programs with unions and trying to get people to connected to jobs, I'm doing opioid, and it's just too much. We need somebody that's solely focused on this issue, because we've had a 123% increase in overdoses, and that's just not cool. And so whether we bring this person in part-time, full-time, or we are contributing some of the work to Aaron Snell, who just joined, and community services, I think there just needs to be some plan where we're not, putting too much of the burden on our cities, on individual members of city staff, Adatola, et cetera, because I don't think that, not to knock them, that they just have the full capacity to lead this charge. I mean, it's been 2 years and we have not seen much. And so that's just my piece, but I'm open to, obviously, this conversation, this good conversation.
Alderman Gay, I think you brought the point home that we do have these people now over the past month or two coming together, so there won't be duplication of services. So 2 or 3 people aren't doing the same thing. And so now they're realizing what their lanes are going to be, and they can come together and talk about what they're doing. So I think you're going to see less and less of that, because they're all pulling together, finding out what each one is doing. You won't have one person running and helping a fire victim, 3 people helping a fire victim. You'll have one, and the other persons will be working on something else. So I think that's the whole point of bringing the 150% group to the table. It's like a triage. It's like I said, cricket in the county, where they all come together and realize, okay, what can I do? What can I do? What can I do? And it makes the word lesser. It goes back to the quote that Director Simmons had at the beginning. If you want to go, say it again, Director Simmons, what was the quote again?
If you want to travel fast, go alone. If you want to travel far, go together.
There it is. And I think that sums up our conversation today. Let me go to Assistant City Manager Lynn Farrell before I get to you, Alderman Shandemeyer, because I think she wants to respond to this issue as well. Thank you.
So, Alderwoman, you said exactly what I was going to say and so I don't even need to say anything now. But I will say that, this is a team effort. The Office of Community Services is working closely with police and fire and OEM, and with the No Harm team. And so I think what we are building here is a comprehensive collaborative to make sure that our residents have access to all of the systems and services that are available to them. And so Alderwoman Pendel Charles hit the nail right on the head when she said, we aren't having duplication of services, but everyone's going around the table and saying, what can I do to help this family? Or this person. So I hope, we're in the very early stages of all of this, and we're learning every day, but I will say that the team is working very closely together.
Good, thank you. The other thing is too, Director Simmons, I know I met with Miss Lee, Erin Lee, our licensed MSW. I think she was embedded in your office for a month maybe to find out exactly what you do.
2 weeks.
How long? 2 weeks. And I think she has been doing that in different departments to find out what exactly you all do and to try to pull it all together to see where the gaps may be and what may the overlap may be in. But she told me she had a wonderful opportunity to spend with you all for the 2 weeks she was there.
She's done the same thing with police. She's done the same thing with police.
Okay. Yeah, and I'm sure she's going to move on to the fire department as well. So that's a great opportunity. She's kind of, in some ways, the hub where the spokes go around. So Alderman Shandemeyer, do you have a question or comment?
Thank you, Madam Chair. Director Simmons, I just wanted to sign on to thank you for helping with pre-registration in Ward 5's Latino community today at the Admiral Farragut Apartments. You, Ms. Gutierrez, the mayor's office, it's absolutely fantastic, the outreach we're doing to that community to help them get set up for the vaccines. So thank you.
And Ms.
Thank you so much, Alderman Shandemeyer.
Ms. Gutierrez is responsible for all of that.
Yes. Yes, Alderwoman Tierney, thank you.
Yeah, thank you. Very quickly, getting back to the numbers, because the numbers are going to mean a lot, when we're going to try to compare if all these groups are successful. In understanding those numbers, first, being a numbers person, that's 2 a week. That's 2 overdoses a week. And so I don't want to take the time now, but we're talking a lot about prevention, but I'd be curious, I'm very curious about the reaction. And I don't know, maybe you do, but not now maybe, but I'd like to hear, when you get that call of an overdose, what happens? What happens to this person? I mean, I know, all I know so far is that the police respond, the EMS responds. But what happens next? And that also relates to the relationship with the Narcan attempt. I mean, how many deaths did we prevent? And who does that? And is that where, we need additional effort in Narcan, just information and access? So I'm probably asking a lot, but maybe next meeting or something, just tell us what happens.
We've been through that today.
Alderwoman.
Oh, you did? I was late.
We can do it right. We can do it right here. Take that small scenario and let's take it from start to as finished as we can. I guess we start with Chief Romali, and then we'll pick up maybe on Chief Jackson and Chief Simmons. So no, we can take that opportunity to do it right now.
Oh, okay. Alderman Payon said you already did it. Sorry, I don't want to repeat because
I'd like to hear it because I need a kind of a structured way of seeing it. So we can do it again. That's fine. And Alderman Gay came in a little late, so we'll do it again. Let's try to do that a little bit.
Just real quick on the fire side, if that call were to come in as an overdose, whether the person's unconscious, not breathing, fire is going to be dispatched with the medic unit engine, the closest suppression piece with EMTs and paramedics on it, and the EMS supervisor. At the same time, this call is going to be shipped to the police department. Sometimes the police department, because they're on the street, can get there quicker than we are, depending on where the call is located. We arrive on the scene numerous times. Either a civilian or the police department have given a dose of Narcan. We'll continue to do life-saving measures to administer more Narcan, CPR, whatever we have to do to bring that person back and transport them to the hospital. At that point in time, for a normal overdose call, the police would do the investigation from there. So once we transport them to the hospital, we don't have any more follow-ups on that. As for the number of people saved by Narcan, I would say that number is just through the roof, because every time Narcan is given, they basically saved a life, because that person is unconscious, their breathing is labored, and if something wasn't done, more than likely they're going to go into cardiac arrest. So that's where we stand. The safe stations is totally something different, but this, for call from an overdose, that's where it goes, and it's turned over to the police at that point.
Okay, so the city effort ends there. Once this person's in the hospital, it's a personal issue and we're not involved anymore.
Well, it depends.
Department effort,
no, it depends.
It moves on.
Yeah, it's no cookie cutter approach to it because you got to realize by law, being high or being under influence is a condition. It's not a crime. And so if we encounter a person who is in distress as a result of an opioid overdose, everything that Chief Ramalley said pretty much holds true with us. The only difference is that's where the Anne Arundel County Health Department comes in at. That's where Sergeant Vaden and Lieutenant Steve Thomas, Anne Arundel County, and Jen Corbin with crisis intervention comes by. Sometimes people will ask us for treatment and we get the ball rolling. We turn it over to them. Sometimes, it depends on the scenario. Sometimes the person is in psychological distress and we do an emergency evaluation, but we have to do it for cause. So that's important to know. We can't force them to go seek treatment against their will. They have to want the treatment, and then we get the ball rolling. Notify the proper people to get them into treatment. So that's pretty much how it works. And then once we turn the ball over to them, then we're out of it. And of course, we keep the statistics. We go get with Director Simmons and Chief Ramalley. We report, whether Narcan was used, whether it saved their life. We keep statistics on that. And I think that Chief Simmons always presents the final stats. You evaluate the stats and categorize them and present them. That's the snapshot version of it.
Hey, Chief, can I add something to that real quick?
Sure.
So that's all pertaining to the victim, but as far as the suspect concerned, if we go to a scene where there's evidence there, the officer makes sure they collect that evidence. That evidence gets submitted. Right. The drugs get analyzed. If there's phones there, we dump that phone into a database and we try to connect those phone numbers to who actually sold those drugs to that particular person. And if we can follow with our federal partners as to make an arrest for that, it kind of build a picture or puzzle, and we put that together, we'll go after the perpetrator on that. So that's a follow-up on the criminal end.
Right.
Thank you so much. I had no doubt.
Yeah, but at the core we do, I'll just end by saying at the core what we do is the same thing as Chief Ramalley does. The preservation of life is the most important thing. Once the life has been preserved, if we can accomplish that through naloxone or Narcan, whatever you call it, once we stabilize them and then the ball gets rolling, that's where the public safety team comes in its entirety through our association, our partnership with the Anne Arundel County Health Department, i.e. crisis intervention. And from there, they're linked to services if the person so chooses. So it's two prongs that Stan is absolutely right. When we have evidence, officers have to do an investigation. If there's evidence that we have the person OD'd as a result of a drug dealer that can possibly be identified, then we take the criminal route as well as the service route. We do both of them sometimes simultaneously. So there's no cookie cutter approach. It depends on the individual circumstance surrounding the OD, the overdose.
Before Chief Simmons
Chief Ramalley is going to go, but Chief Simmons, if you wanted to piggyback after Chief Ramalley, and then if Ms. Farrell wanted to add something as far as the community services, and we can do that. So go ahead, Chief Ramalley, and then Chief Simmons, and then Ms. Farrell.
Yeah, that's exactly where I was before Chief Simmons got on there. I just wanted the Alderwoman to know that sometimes it's a very difficult situation for us in public safety, us in the police department, because these people got to want help for us to be able to get the health department, the social workers involved, mobile crisis involved. There are people that were dead when we arrived on the scene. They were not breathing, their heart is not beating, that we bring back to life and refuse treatment because we were able to get them back to where they're cognizant, they can answer all the questions. The police department can't just do an emergency petition on them just because they overdosed. We all know it's a disease, it's a crisis, but there are times where once we bring them back, people don't want anything to do with us. They sign a report and they walk away, and there's nothing we can do about it. We try to educate all the time. We educate their friends that are on the scene. Sometimes it's the police department educating, sometimes it's the paramedics educating, sometimes it's the public, because we'll tell their friends, look, you got to make sure that that the Narcan we gave them was enough, because they may relapse back in because the Narcan wasn't. But we give them multiple options, but sometimes our hands are tied, and it's very difficult for our people because we run these on a regular basis. And I just wanted to make sure you knew that before Chief Simmons jumped in.
Understood. Can't help somebody that doesn't want to help themselves.
Right. Director Simmons, did you want to chime in? And then our Assistant City Manager, Lynn Farrell.
It is a lot more moving parts. They just covered half of it. It's a lot more moving parts. The police department has a crime analyst. That crime analyst compiles the overdose information. And based on that information, it goes to the OD-free map, and we take and analyze that information and try to figure out what prevention methods that we need to do, what harm reduction methods we need to implement, and treatment. So it's just ongoing thing. And what we're trying to do now is that we're trying to follow folks from treatment to quality of life, which I talked about earlier. That's a new component that we want to add on there to make sure that they have enough support, that they don't fall back into the game.
So you do a map overlay, you know where these are, and from that information, can you, I don't know how to ask this, but can you establish, you know, are there triggers in a certain location? Is that a fair question?
A lot of time, yes. And what I would suggest to this group is that we could probably spend a whole public safety committee meeting talking about this, and I would suggest that we do that, because a lot of folks follow what we're doing, but what I'm surprised is that if anybody at this point in time to think that we're all acting independently, we're not. We've been together for a few years fighting this effort, and the pandemic kind of exacerbated the problem. So I think that maybe I would suggest that we take a public safety committee meeting and then kind of concentrate and make everyone understand our efforts in trying to thwart this substance use disorder in the city of Annapolis.
I just want to throw one more thing there, Alderwoman Tierney. Everything is laced with fentanyl, and that presents a challenge, and almost insurmountable. Everything is laced with fentanyl, marijuana, I mean, everything, cocaine. They're putting fentanyl in everything. And so you have your normal drug distribution compounded by the fact that they're laced with everything, which makes it very deadly. And like Chief Romali said, I've seen it since I've been in Annapolis. Sometimes they're clinically dead. We'll bring them back to life. They're in full faculty. The Supreme Court says being intoxicated is a condition, not a crime. So if we don't find drugs obviously on them or laying there, our hands are tied as to any enforcement efforts. We can only offer them the treatment. And I've seen it with my own eyes. They'll get up and walk away. A person 15 minutes earlier wasn't breathing. Now they're conscious, they're in their full faculty. If they don't want any help, then we can't compel them to do it if we don't have anything else to go, and probable cause to detain them or a good reason to evaluate them, do an emergency petition on them. If they, you know, we have to show that they present a danger to themselves beyond just getting high, because many of them don't intend to hurt themselves. They'll just buy marijuana laced with fentanyl and start getting high with it, thinking they got normal marijuana and unlaced marijuana. And next thing you know, they're in crisis.
Yeah.
Chief Jackson, I just want to, when Chief Simmons brought up the fact of follow-up with folks, even though you have a reentry program, it's not just for folks who we normally would think of reentry. We're talking about people who down on their luck or whatever has nothing to do with any substance use disorders. So they can go directly from Chief Simmons if he sees the need to your reentry for PEPP program and come over and get the help or the assistance they need from you all. So that's not totally a separate item there. I'm gonna move it on to Ms. Farrell as far as the follow-up and the Office of Community Services. If she'd like to give us a brief synopsis of that, that would be helpful. This is extremely important.
I would just say that that the Office of Community Services and Erin Lee, in her role as a social worker, works closely with Michael and with Baden and the other members of the police department on many of those emergencies after the fact to make sure that the human services are met, needs are met. And so, you know, as much as she did with the families in Robinwood who experienced the fire, you know, with the fire department, she hopped right in the car with OEM, and they rode over to the scene and were right on top of it. And she continues to work with those families. So that's the one thing about the Office of Community Services is that, you know, we're not letting people go there. you know, once we have you, we hold you until we, you know, until you're nurtured into a place where you're secure in your own work. So I mean, you know, this is a ship we're building as we're sailing it, but we certainly have seen the fruits of this labor working so far. And so if you all saw the article in the Capitol about the Robin Hood families, because they wanted to thank people, and there were so many people in our community that reached out to help them. They wanted to publicly thank those folks. If you read that article, you'll see how all of this is coming together when a family is in crisis.
And the beauty of Miss Lee is she used to be with the Department of Social Services, so she already has that mindset, and she's been in the culture of helping. So we really appreciate that. Yes, Alderman Gay.
Thank you very much. I just have a couple of things to go through. To Ellie's point, when she's breaking down the numbers, 2 a week, that's 2 reported. That's 2 on what they actually walk away with. You know, there are so many times in communities where people are overdosing and they are getting the Narcan from neighbors or whatever and getting up themselves and walking away. And we don't get that. We don't have that data. So it's more than 2 a week. To the second point of the quote, I'd rather move it slow in a group than fast. I don't know what the quote was. When there are lives involved, I'd rather move fast and with the group, fast and single, fast or whatever. I just think that what I'm hearing is we are very reactive instead of proactive. We have, procedures in place to go to the scene, scope out evidence, and to, do criminal activity. We have plans in place to go to the scene and try to get the person back to the best of their ability that we can. And I don't blame them for waking up high off of heroin and saying, I don't want to go to the hospital. Who the hell does? I don't know what's going on. I'm just waking up from a high, And so if we could put in place programs and situations beforehand so that they don't even get to the point where we have to find them on the ground or on an apartment building or on a playground in front of kids high and, like out of their mind, like that's the thing. I don't know. I get that the work is being done. I really do. But for me, if I look at something, it's just like if you run a private organization. If you're looking at something and you're seeing it's only getting worse, you would go back and say, okay, well, what can we do from step 1 then to fix it? And I've only been on this council for 2.5 years. And every year that I've been on it, the opioid issue has gotten worse, not better. And so that's the mindset and the lens that I'm looking at it through. That's not to say that the work of the staff is not, effective. I'm looking at the numbers though, and realizing too that at some point, even though now it's not that way, the most deaths in opioid overdoses typically comes out of Ward 6. So it's my constituency that I have to turn around back to and say, oh, well, we're, following up with, when they're all, I can't continue to do that with so many friends and families. And I would hope that we would figure out some proactive approach to help these families. That's all. That's all that I want. I'm not trying to be hard on anybody. I know people think that I hate public safety and all of that stuff. Hell no. I love public safety because you fix problems. I just would like for them to be viewed from the lens that we are seeing them from, of our friends and family dying weekly due to this. And, they'd like some urgency. And so that's just my thing. And I'm just being a conduit for my constituents. So I appreciate the work that you guys are doing.
And Alderman,
Thank you, Alderman Gay. I want to mention one thing about that quote. I first heard it in the African American Caucus Leaders Meeting. It's an African proverb. So I think I think we can take note of that to some degree. The other thing I want to bring up, the fact is sometimes we get lost in what's really and some of the good things that's going on. And I'm going to give a spotlight shout out to 2 young ladies here today. Number 1, Tony Strong Pratt and Rita Dorsey Washington, who have saved, and I know Chief O'Malley knows this, have saved countless lives, especially in Ward 4. And so they have done a tremendous job. And I think at this point, their good works and others as well should not go unnoticed, because we tend to kind of get lost in some of this. And when they save some of those lives, those are some of the walking and living testimonials of people saying, you know what? I need to turn my life around. The same with Miss Lee. When someone helps her, when she helps someone in a fire or whatever, that's a personal testimonial that gets transferred to that person and that family and that community that says, you know what? I'm going to turn my life around. So you never know what small nugget, large nugget, medium-sized nugget is going to change somebody's life. A simple act of kindness, one person, two people. But right now, the shout out today goes to Tony Strong Pratt and Rita Dorsey Washington for saving many, many lives on many cold nights out there on their way to a funeral, on the cement when it's 10 degrees outside, saving lives. I think that should not go unnoticed. They've done a tremendous job, especially in Ward 4. Director Simmons, did you have something to say?
No.
Anyone else have anything to say about, did we know? Do we know? Have we known? I do have two things as the chair. Number one, the NAA, Alderman Pound, do you have a question? I thought I saw your hand go up. Okay. I was asked to write an article for the NAACP e-newsletter for February. I asked Chief Romali, Director Simmons, and Chief Jackson to provide some input. And the e-newsletter went out. I thought it went very well. And it capsulizes to some small degree what we're already doing. But there's always more that we could have. And I captured it on an old song of the Spinners, I'll Be Around. I'll be around when they call me, when they need me, when they want me. And I used all three of our public safety teams as highlighting those three themes in that song. So it shows my age. Number two, did you know that recently the 100 Club of Anne Arundel County presented their Unsung Hero Award winners for 2020. They honored various individuals who represent the finest from our 13 public safety agencies throughout the county, including in this recognition for outstanding service are two of our city's finest, namely Annapolis City Police Department Officer First Class Richard Farger-Harrison and Annapolis City Fire Department Captain H. Dallas Lister. Their photos appeared in the Capitol newspaper on yesterday, Sunday, February 28th, on page 8. A huge congratulations for a job exceptionally well done. And here it is in the Capitol newspaper on yesterday. So that's the chair's spotlight and a did you know for today's meeting. Any other comments, questions, suggestions on public safety spotlight? Did you know written reports and comments and year-to-date overdose summary? Anyone else? Okay, we're going to move on to number 3. Legislation before our committee, R-65-20, drug loitering free zones, repeal of fines. I know that we had this legislation on our agenda last month. It was the drug-free loitering free zones, but this time it's the repeal of the fines. And I don't think any of us have a problem. I think we've all read over the staff report and it was found to be unconstitutional. So unless we have a discussion at this point, are we ready to take a vote on the repeal of these fines under drug loitering free zones?
I move that it be repealed, Madam Chair.
Do I hear a second? Alderman Gay, did you want a second? Thank you. Second. And all in favor? Thank you. All in favor say aye by raise of hand. All right. Any opposed, no. That passes. And so that we have recommended that there be a repeal of fines. Moving on to O-5-21, Tucker Street Launching Facility, for the purpose of providing procedure for use of the Tucker Street Launching Facility, providing certain definitions, establishing a separate acceptable proofs of residency for issuance of certain permits, and providing penalties for violations. I've had an opportunity to read first reader, staff report, fiscal impact note, and we have our two chairs here, Alderman Payon as well as Alderwoman Tierney, regarding this legislation. Would either of you like to speak to that? Alderman Payon.
Thank you, Madam Chair. This provides for the basically the rules and regulations that will govern the use of the Tucker Street launching facility. And the rules and regulations are the same ones that we have at the Truxton Park facility. They spell out exactly what you have to bring to prove you're a city resident. There's really not a lot else to say. It's pretty straightforward.
Okay, thank you. Alderwoman Tierney. You're on mute.
Yeah, hi. I co-sponsored because I'm sort of tasked with cleaning up Title 15 with the Harbor Master, Beth Bellis, who's doing an awesome job clarifying the code. And that was another objective of this legislation, to make clear that it's her responsibility in lieu of Parks and Recs. Because right now, if you go there, the sign reads, parking permit required, and that's another optic. It's always been residents only. This is getting a lot of attention because people think that we're introducing it to be residents only. That's not the case. It's always been, specific to West Annapolis, and it says, please contact City of Annapolis Recs and Parks Department for permit information. Now that will be with the Harbor Master. So I just wanted to clarify the other reason for the legislation.
Thank you. And according to our staff report, this will be moving from the Title 11, which is Public Peace, Morals, and Welfare, which is tasked under Public Safety, Title 15, Harbors and Waterfront Areas.
Correct.
Okay, thank you. Any other comments regarding this legislation or questions? Yes, Alderman Shandemeyer.
Thank you, Madam Chair. Alderman Payon and Alderwoman Tierney. So this legislation would literally just clarify the boating ramp, so it's the exact same as Truxton Park. There's no additional restrictions on it or anything else.
I don't believe there are any restrictions at all in addition to what's at Truxton Park. You have to be a city resident. When we say residents, you don't have to be a resident of West Annapolis, where this is. Although I have to say the people that live there would love to limit that, but that's not going to happen. That's pretty much true. And what they did that's a little bit different is they spelled out exactly what you need to prove you're a city resident. Obviously, there have been some problems in the past, and it sounds a little bit totalitarian. It's really not. They just said, these are the things that prove you're a city resident. And I don't know what else. I've not heard of any other controversial parts of this. I think people are, I think without reading it really carefully or without having the background, shall we say, at the, which committee was it, Alderwoman Tierney? I can't remember. Was it rules? I can't.
You mean as far as having an issue?
Yeah, there was one committee that had an issue with it.
Well, yeah, thank you for that. Just full disclosure, I attended the Annapolis Environmental Commission.
Okay.
And I sort of summarized their position because they have a backlog of position papers to write. So I told them I'd relay the opinion, and their opinion was that they thought, they understand now that it has always been for residents of the city of Annapolis and continues to be, but they disputed, the chair, Bevan Bukaiser, disputed the reason of congestion and all, because she has a slip across the way and she never sees the congestion. But also they thought that it was onerous to say Hispanic community that doesn't understand the permitting process, and it might, it's not friendly or not open to all residents, and thought the requirements were a little bit, as Alderman Payon said, too onerous. I relayed that concern to Fred, Alderman Payon, and the Office of Law to see if there was anything they could do to soften the requirements so it's more adaptable for that use. So that's the criticism that it's getting right now.
Okay.
Thank you, Alderwoman Tierney. Any other questions or comments? Oh, I'm sorry. Go ahead, Alderwoman Tierney.
I'd have a question. I think, and Alderman Shuttlemeyer, you might know this, when we have legislation approved, when we roll it out, I don't know if it's bilingual or not. And that, I know that when I do traffic stuff, I always have a bilingual notification. And I think that's a suggestion I have, is that when this does get approved, that we have a rollout, bilingual rollout of the law.
I think our Hispanic service is usually pretty good at that, but I
I'd say because you have a large Hispanic
policy.
Yeah, I only ask you because you have a large Hispanic community.
Okay. All right. Thank you so much. Any questions or comments regarding O-5-21?
I move that
we're ready to vote. Thank you. I've heard a motion to approve O-5-21. Yes, Alderman Gay.
I'm sorry. I was reading the wrong piece of legislation this entire time. Is this
That's okay.
Is this for the traffic study itself, or is this a completely different piece? I'm trying to log in at legislate right now as we speak. I was on the wrong thing.
We're on Tucker Street launching facility. Tucker Street launching facility.
Yeah, I know this was Fred's. Okay, awesome.
Okay. Can I hear a second on moving this favorably to our colleagues?
Second.
Okay, second. All in favor say aye. Aye, by show of hands. Okay, I see no nays. Therefore, we will be recommending this piece of legislation to our colleagues for favorable. Next on the agenda is O-19-19, adequate public facilities, auto transportation facilities. We had this piece of legislation on our agenda back on February the 1st. There was much discussion. Alderwoman Tierney and I have been going back and forth, as well as Alderman Arnett. And I see on the notes that back on February the 9th, 8 days after we had it, there were some rules committee updates, 1 to 5 amendments on here, I believe, from Alderman Arnett. And I know we wanted to keep in lockstep with the Transportation Committee as far as moving this legislation along to its end. And so I would be recommending a postponement, especially in light of the additional amendments on February the 9th, which was, like I said, 8 days after our meeting. So does anyone have any questions or comments? Alderwoman Tierney, would you like to add anything to that?
Well, I think, yeah, I think I'm sort of struggling with this legislation because it's just been on the timing has been complicated with our adequate facilities attention and all, and it crossed the threshold of amending, I thought, but then there was this heroic effort by my colleague, Alderman Arnett, to amend and to meet the Planning Commission's comments. So with that, I mean, it is misleading because I think their in turn is about like a lot of amendments, but he basically revised it, and every insert is an amendment, but it's revised legislation, I would say. And it's I think he did a great effort in that, and it's the best that it can be right now. I wish we had a traffic engineer, though.
Yes. Ms. Green?
There are actually 14 that the Rules Committee only got through 5 of them. So that's what you see there.
Okay.
Yeah, they're going through it page by page, and that's the tedious part of it, yeah.
God, what a bear this thing is.
Yeah.
But anyway, I would recommend that we postpone it like transportation did to kind of stay in lockstep with them and follow along as we go.
I'll make the motion.
I'm sorry, what'd you say?
I'll make the motion. Technically, you probably should not as chairperson. So I'll move that it be.
I was recommending it. I wasn't making a motion. I was recommending.
I'll make the motion. We postpone.
Okay. Do I hear a second? Alderman Gay, I can't hear you. You're on mute.
To postpone, correct?
Yes, sir.
I would support the amendment to postpone because I probably was not even going to vote in favor to send it to committee because I still have concerns about the decrease in the number of traffic counts or cars or whatever it is that Ross wants to drop from 150 or 200 to 50. With the concerns that the department head of planning and zoning has mentioned and how much work it would be for her and how it may be unnecessary. And so I will support the postpone, but I do have concerns about the bill in its entirety.
Okay.
So second.
And I think we all do have some as well. But anyway, I've heard a motion and I've heard a second. All in favor of postponing this piece of legislation, signify by saying aye or raising your hand. Okay,
Aye.
all opposed, I see nay. So therefore, this matter will be postponed to our next date, I do believe.
And it's handed off again. Sorry.
The other
I'll
thing-
take it.
Yes, Ms. Green. Okay, Ms. Green.
Before you conclude, can we go back and revisit R 6520? You guys did a motion to repeal. And
Drug-free lowering zones, repeal of fines, R 6520, yes.
yes.
To
Can
move it
we-
favorably.
Yeah, for clarification purposes, can the motion be made to vote favorably or unfavorably?
Move. Yes, yes, ma'am.
Thank you.
We'll have a motion to move it favorably onto our colleagues. Alderman Payon, did you want to make that motion so we make sure we've done everything and crossed every I, dotted every T?
Yeah, I sure will. I thought I already did, but I'm happy to
No,
do it
you
again.
guys
We'll do it
made them.
again.
Your motion, your official motion was to repeal it.
Okay.
Okay, all right. Okay, I thought I was reading it, but okay. All right, Alderman Payon made the motion. Alderman Gay, would you second, please?
Is he making a motion to recommend unfavorably or favorably?
No, favorable.
Favorably.
But I thought we were killing this, so wouldn't we recommend it unfavorably so that they
No,
don't?
the motion, this is to repeal. That's where it said.
Okay, for the repeal. Okay, I second the motion for R 6520 favorable to the full council.
Absolutely. Okay, all in favor say aye by show of hands or grunt. All right, I see no nays. All in favor, we will see it's unanimous that we will move this piece of legislation favorably to our colleagues through the Broad City Council. Yes, Alderman Gay. I have one comment before we close. Alderman Gay.
Okay, yeah, I did as well because I didn't see R 420, and I know that that's something that we had discussed. And I was hoping that the amendment could still be passed out of public safety tonight to give you the option ahead of the Planning Commission findings to make that pitch to the full council. This is for 0420 medical cannabis dispensaries.
That's not on the agenda.
Yeah.
Yeah, I thought that you were, we're going to add it so that we could do the.
No, we weren't going to add it because we had talked about having the joint meeting with rules. And since you said, so I did not have it put on the agenda. I was going to wait for the joint meeting.
Okay, so that'll be in the first meeting in April then. Okay.
Yes. Did you want, now I want to ask you, since you brought it up, did you want that for the Public Safety Committee Monday night, or did you want it for rules for afternoon, or in the afternoon for April?
Well, I think that it would make sense to do it in public safety so that we recommended, I told you that I would do that. I keep my word, recommending it out of public safety favorable. Then it could have full debate in both. Well, not full debate, but it could be mentioned in rules of city government and then have full debate before the council at the first meeting in the month of April, the first full council meeting in the month of April.
So my question is, did you still want to have that joint meeting with rules and public safety on Monday, April the 5th?
Well, what meeting would our first rules and city government meeting be in April?
The 6th. The 5th will be public safety. The 6th of April would be rules.
All right, yeah. So I think we should do the amendment on the 5th and then the joint meeting on the 6th. That's just my personal opinion. I'm open to whatever you guys want.
Well, let's start on the 5th. And if there's something we need to nuance or meander, then we can move it to the 5th. So I'm all in favor of having the 5th, the joint meeting. And then if there's something else that we need to talk about, we can always move it to the 6th.
Okay.
Let's start with the first date in case we need to move to the second date.
Can you confirm that,
Ms.
Tia, with, I'm sorry, Madam Chair, I didn't mean to interrupt you.
Let's go ahead. Go ahead.
Could you confirm that with Alderwoman Finlayson so that she is aware of what's taking place? So, because we may have to amend the agenda to include a portion for 0420 on their first Rules of City Government meeting of the month.
Alderman Gay, the other thing is too, are you going to bring in the professor on the 5th?
Well, it depends on what you would like. I knew that in my
bring the professor in on the 5th. I had thought, and I think the professor would be fine on the 5th.
Okay, I will be. I should, his 3 topics that he has said that he would discuss would be, well, public safety, I guess, is included in that. So yeah, that's appropriate. Yeah. Okay.
Because then we always got the 6th if we need it for something else. If we start on the 5th and we have to either move it or continue or whatever so we're going to have the joint meeting of Rules and Public Safety on Monday, April the 5th at 4. And your professor, do you have the name of the man or woman?
Yes, I do. 1 second. I got you right here.
Okay.
I just sent an email to him earlier today. Shad Ewart, or it might be Awart, E-W-A-R-T. First name Shad, S-H-A-D. And that's
S-H-A-D. What's the last name again?
E-W-A-R-T.
E-W-A-R-T. S-H-A-D E-W-A-R-T.
Yeah.
Okay. And he's at the community college. Okay.
Yeah.
Okay. All right. Okay. Ms. Green. Okay. Thank you. I have one thing I want to say in light of the conversations we've had here, and I think it's very relevant. I mean, we know that in the city, we cannot cover every situation. So just for Alderman Gay's edification, I think everybody else has heard this. Back in 2006, when I started with the school system, Sharon McKellen and I started a program called Community Ambassadors. And what they are basically people in the community, and one of them was Bishop Carroll's mother, Betty Ann, and she and I went to high school together. She was embedded in Robinwood. She was assigned to Robinwood, work with the students. What she did was on a Monday morning, she would come to the school, find out if little Timmy wasn't there. If little Timmy wasn't there, she would drive to Robinwood, knock on the door, get little Timmy out the bed and make sure he got to school. She would walk the hallways. She would talk to the teachers, the counselors, sit in the cafeteria. She had a caseload. We started off with 12. As time went on, I moved out of that department, that unit that was handling it. They kind of waned. We brought them back, I guess it was about 4 or 5 years ago. We had a situation where the city actually had to pay for 4 of them. This was the school system's responsibility, but I talked to Tom Andrews, a former city manager, and we decided that we were going to pay for these ones so we would not have a gap. Miss Tippy was the first one, and she's still there. She deserves a medal, and I won't get into that right now. So anyway, it got to the point where Miss Tippy was basically handling the workload for all of Annapolis. It was too much. I went to Dr. Gillens in the Office of Equity and Accelerated Assurance, and I said, we need to do something. That's when the city took upon itself with the small budget we had to pay for 4 to help Miss Tippy out. The next fiscal year, they got the money, and it was in the budget to hire 6. Dr. Arlotto, the superintendent, I got into a little friendly battle. He said 6, I said 8. He said 6, I said 8. It went to the Board of Education. They gave us 10. It went to the county executive. I lobbied them. They said 10. Went to Lisa Robin. She said 10. And it went through with 10. This year, the Board of Education, in its wisdom, realized now it's moved on to the county executive. We're looking for 18. Now, some of them are going to be divided amongst the county, which is fine. We don't have to be. But all of the disproportionate schools that I work with, hopefully, if it goes to the county executive and then to the county council, we will have at least a part-time person in every disproportionate school in the city of Annapolis to do some of these things that we're talking about. They can certainly partner with our 150% group and do what needs to be done in our schools, because really, when you think about it, when we're talking about what we've got here in the city, our human services, and if we're looking to partner with education, it's a perfect marriage. So Alderman Gay, all is not lost. We're working on this. Like I said, the city in its wisdom, and Teresa Sutherland always said, Rhonda loves those community ambassadors, and I do. And so because they've done tremendous things, not only do they work on education, we've got some people who've done DSS work. They're working with pregnant teenagers in school. They're working with WIC. They're working with the health department. They're working with all of these things. So we're talking about a great marriage that has been going on, may not be totally publicized, but it's going on, and things are happening and are happening tremendously. Miss Rita is one of our community ambassadors. She's been there for a long time. And so we're doing things that you may not necessarily see, but things are happening. And I normally don't bring up school system things and public safety, but I thought since we were on this conversation that everybody needed to hear this. You have any questions about that, Alderman Gay?
No, I think it's a great program. I'm aware of it because, you know, when I was in school, Miss Chippy was there often. You know, she helped my brother who, you know, they always say it's always one in the family. If I'm like this, he's got to be. So she was always on him, making sure that he got to school and stuff. And so I think it is important, you know, and those are the things that I think that we should continue to turn attention to and fund. Because again, it's on the grounds, interacting daily with people. And we just realize how important that relationship is between the school system and the city. Like yeah. So I appreciate that. Absolutely. 100%. And if we have to fight for it in this budget this year, you have a friend in me, 100%.
We'll go right ahead. And the thing I want to bring to your attention, of course, Dr. Arlotto is our superintendent, is the big supervisor. I guess, had the nerve to take him on, for lack of a better word. So, that's how much I thought about it. And he was my supervisor for a while as well. So we have a great relationship. So I was not afraid to go toe to toe with my big supervisor. So that's how I feel about the whole thing. I felt that much passion about it that I was willing to do it. So he and I have a friendly rivalry that we continue to laugh about and continue to have a great partnership. So just want to bring that. Normally I don't bring school system business onto city council, but I thought since we were on this track that you needed to know what had been going on since 2006. And like I said, it had waned and then we brought it back. Thank God for the city. I got Alderman Arnett said, you know, I'm fine with it, but please, they've got a huge budget, but everybody on the council was very amenable to voting for it, even though it was not technically within our wheelhouse. That says something for the council that we have going on. So anyway, with that being said, any other comments, suggestions, or questions, or for the good of the order before we conclude?
I think this was a good meeting. It was a great meeting.
It was excellent. Alderman Payon.
I move that we adjourn.
Second.
All right. Do I hear a second? All right. All in favor? Aye. Thank you so much. Public safety team, you can't be beat. Can't be beat.
Thank you for letting me